I think conventional impressions will be a thing of the past in 2025, and education and prevention will be the forefront of clinical dentistry, with patients becoming more empowered about their own oral health.
It will be interesting to see how technology will shape and direct the provision of dentistry for the majority of patients. A lot of the current advanced products and services that we have within the field are often seen to be under the remit of higher end care and specialist services, but it will be great to see these become more affordable and more accessible.
So due to an improvement in oral hygiene education, I feel like there's more of an overall trend towards having more naturally retained teeth. Not only this, but there's more elderly patients who are tending to live for longer. This just means that there might be more care home dental care needed. Not only this, aesthetic dentistry is also becoming the forefront of dentistry, which just means that dentists would want to publicise their work a lot more using social media, Instagram, Facebook, Twitter, etc. to publicise their skills. Also, there's a huge digital revolution that has occurred where I feel like all GDPs will have digital x-rays, CAD/CAM restorations being made at the dental practice. There'll be lasers to remove dental caries, huge advancements in this sense, and this is what excites me the most about dentistry.
I imagine that minimally invasive dentistry and preventative dentistry will be well established within the profession, but most importantly, and probably the most exciting thing for me, will be the heavy reliance on technology. Things like CAD/CAM technology, 3D scanning, all of these will be vital for the treatments that we do, and I think it will improve the treatments we provide to our patients, as well as improving patients' lives and making it easier.
I expect to see the greater use of technology in the dental world. I see us using digitally driven patient education systems where we show them tutorials in the forms of videos and photos on how they can manage their oral health care better. In terms of dentists, I see us progressing in the instruments that we use. For example, laser instruments for surgical procedures, and more computer-aided design and technology for crown and bridge work, chairside. But as a young dentist, I'm most excited about going to third world countries and using my skills and my experience to help poor communities improve their oral health care.
We've got the introduction of lots of different mediums of technology, such as education, specifically digital education, which can really be utilised in the dental schools specifically. So this can be with applications that will be used, as well as virtual reality softwares and haptic technology. So this is all to aid the dental student, as well as the graduated dental professional, to be able to manage and learn more about the dental qualifications as they are practicing.
I think dentistry will be even more preventative, with more of a focus on preventing dental disease rather than treating it. And I think the whole dental team will be involved in the process, with more auxiliary staff helping out, like more oral health educators.
What excites me most is the constant changes and advancements in dental technologies and materials, and that's something I've seen as an undergraduate and since I've qualified. So hopefully a positive change in the oral health of the population means we'll have more opportunities to utilise these advancements and improve and develop our clinical practice.
I believe digital dentistry is the future. Our profession has experienced a wide amount of technological growth. It's an exciting time to be in the dental profession as more and more technologies are being introduced that makes dentistry easier, faster, better, and more importantly, enjoyable.
I imagine almost everything to be completely digitised, which means more comfort for the patient as well as a greater level of care as a result of improved diagnostic tools. The research on biomaterials regenerating tooth tissue is what I'm most excited about.
I imagine that the standard of clinical care will develop significantly. However, I'm more excited to see that this will happen by principals and practices developing and focusing their businesses to improve patient experiences, as well as technological advancements.
I'm excited about the future of dentistry and its continued drive towards preventative and minimally invasive procedures, and I look forward to seeing how technological advances play a role. I also believe in the future we'll be working much more closely alongside dentists in an interdisciplinary team environment.
On a typical day for myself, I see many patients with various stages of periodontal disease and a high incidence of dental implants, as we predicted. So I'd like to look forward to more tailored products for these patients, and ones that really help facilitate cleaning in an effective and simple manner for these patients.
By 2025, the dental industry will have fully embraced digital dentistry. And what I mean by that is not just the sort of clinical developments in CAD/CAM, milling, scanning, but also the sort of marketing trends we're seeing in terms of social media or video marketing, and the way that consumers are interacting. And unfortunately, patients are becoming more like consumers. And I think with that, unfortunately, I think by 2025, with globalization, the world getting smaller and smaller day by day, dental tourism, I think, is going to boom further, unfortunately. What excites me the most about 2025 and looking into the future in general, just the sheer rate at which everything is developing in our industry. That's also quite scary when it comes to the materials and how quickly we have to retrain ourselves, and evidence base that actually exists for some of the materials and techniques that we use. So it's really exciting how things are developing, but it's also quite scary.
We have virtual reality that is growing fast, so might play an important role in the future as well. Regarding the procedures that we'll be doing, that will strongly depend on the prevention programs in the past couple of years and the years to come. So I hope that we'll soon face cavity-free youngsters. On the other hand, we have population of Europe that is getting old, so we'll probably face more and more oral diseases. As we are placing more and more implants, we'll soon face a lot of peri-implantitis as well.
I'm quite excited about how futuristic innovations will help with developing tissue transformation to regenerate replacement teeth and periodontal tissue in humans, which is as important as caries prevention.
Two main things that I want to help innovate in the field, and one of which is obvious. It's what I'm wearing right now. It's Google Glass. This is just one product of a category of technology called augmented reality. And the idea behind this sort of technology is to make technology less obtrusive for patients and more efficient for providers. So the hope is at some point we'll reach with technology like augmented reality and cloud systems for electronic health records, that things will move on quicker, more accurate, and better for patients and the ease of providers. We have sort of technology right now with electronic health records, with some tablets and some software, but they don't really work well to each other, and certainly it doesn't work well amongst other providers between practices. Now the second part clinically is my number one dream, and that's regenerative endodontics. So this whole idea of not obturating canals in the future is absolutely possible. Right now in root canal therapy, we remove bad tissue, we place a root fill in there to prevent infection, but we'll reach a time where we can regenerate pulpal tissue.
Well, I'm training periodontology with Mariana Sanz in Madrid, and we are fighting to remark the importance of periodontal diseases in systemic conditions, such as diabetes, cardiovascular diseases, or rheumatoid arthritis, and their impact to control those diseases and to decrease their consequences. That, in turn, would diminish the medical costs in our hospital. It would be fantastic if in 2025 we would reach that position, and with it all, to achieve prevention not only for periodontal diseases, but for systemic conditions and their complications in our patients, going to a completely new period in 2025.
I feel that we will have an integration of dentistry into comprehensive healthcare, and there will be an increased focus in the link between oral healthcare and the overall healthcare. So more improvised versions of technology will be developed for diagnosis and treatment planning, and there would be importance to gene-mediated therapeutic measures.
Imagine a world in which patients will be able to take an active role in their treatment and either monitor disease activity, or why not perform some basic procedures, maybe dental clinics, who knows, we'll see. On the other hand, definitely the use of technologies, 3D printing, and outstanding regenerative techniques that have been discovered will help us implement and improve the care that we're rendering to our patients. I do believe that personalized medicine and genetic testing will be something normal for the future of dental practices. but none of them can happen if we don't collaborate and we share information.